Hi, I'm Nicole Ferraro, and this is The Divide, a podcast from Light Reading exploring the ongoing digital divide, why and where it still exists, and what needs to be done to get people everywhere connected to reliable, high speed internet. Today, I'm joined by Danielle Perry, who serves as a board member at the National Lifeline Association, or NALA. We discuss a recent consumer survey conducted by NALA that reveals the significant impact the loss of the Affordable Connectivity Program subsidy has had on low income broadband households across the country since it expired last June. We also discuss the work that NALA is doing this year to advocate for the preservation and expansion of affordable broadband benefits. All right, Danielle, welcome back to the podcast. It's great to see you. How are you?
I'm well. Thank you for having me. It's great to see you as well.
It's my pleasure to have you. So we're going to talk today about a survey that the National Lifeline Association recently conducted and some stuff that we learned about recipients of the Lifeline benefit, as well as former recipients of the Affordable Connectivity Program benefit, which expired last June 2024 at this point, officially ran out of all of its funding. But before we get into all of that, why don't you quickly reintroduce yourself, and your role at NALA?
Sure. So my name is Danielle Perry, and I'm the Chief Compliance Officer at a company called TruConnect. And I also serve on the board of directors for the National Lifeline Association, and I'm the chair of their Government Regulatory Affairs Committee.
Yes, you are a busy lady, and we always appreciate whenever we get to chat with you. So, like I mentioned, NALA recently shared the results of its annual consumer survey, which we're going to get into those results, which were very informative. But before we dive into that, why don't you tell us a bit about the survey? It's obviously an annual survey, but who do you all survey for this? How many respondents for this one? And why do you conduct this survey? Also, when was this particular survey conducted?
Okay, perfect. So every year, the National Lifeline Association asks their members to put a survey out to all of the consumers that they provide service to, and we do this just to get a feel for, what do our consumers need? What are they using the service for? Who are we serving? We like to have our finger on the pulse of the community out there. So we do it every year, and we ask varying questions. This year we conducted the survey from November 1st to November 26th. And I have to say, in all the years that we've done this survey it just blew us away with some of the data that came back. So we had 68,000 respondents, and these are all Lifeline and former ACP subscribers. So 68,000 respondents, and that included 11,000 unique zip codes, which is a quarter of all US zip codes. So, I mean, I think we hit, a broad population here. So the respondents, or the response was great. And we just learned so much about, the subscribers and what they were using the service for. And I can dive into that if you would like.
Yeah, absolutely. We're going to get into all of that. I should back up a moment and just clarify for anyone listening that the Lifeline benefit is part of the Universal Service Fund. It's what is it, $9.95 a month toward telecom services, right?
925. Yep.
$9.25. Okay, gotcha. Even less than I thought.
Right.
And the now dead Affordable Connectivity Program provided a $30 broadband subsidy per month for roughly 23 million households. Some of that went toward mobile services, some of that went toward fixed broadband services, and none of it exists anymore. And so we're going to talk a little bit about what that means for the people who took your survey. But I just want to say that is an incredible sample size. So I hope that people in the industry really take these results to heart, and people in government as well. So let's talk a little bit about the survey respondents themselves. Obviously, we know that they are recipients of Lifeline and were ACP recipients as well. But what did we learn about their household income, their employment status, and their overall need for a low-income broadband plan?
Okay, great. So we learned that 60% of the respondents had a household income of below $10,000. So that was really surprising that it was such a large percentage that would be at that far under the poverty level. So
Yeah.
that was one of the striking things. We also learned that nearly a third of the respondents were disabled, and about 40% were unemployed or retired. Seniors are relying on this program heavily. Over half were older Americans, with about 22% being between ages 50 and 59, and 30% were over the age of 60. So we're definitely hitting the the older population out there. The other interesting fact that I really was happy to see kind of teased out is we hear a lot about this program being an urban program and benefiting mainly urban residents, but about 60% of our respondents were non-urban, with 37% rural. So it just goes to show that the issue has a broad impact across the country and that it's really not just an urban program.
Okay, I think that's really important to note. So in terms of, so like I said, the ACP is no longer. So, but the people taking your survey are still receiving the Lifeline benefit, as far as we know, right?
Correct.
So, what did we learn from the survey about the impact that the end of the ACP, the much larger benefit of the two, has had on those? What sacrifices have people had to make? What have the consequences been, based on what we learned from the survey?
Yeah. So, crazy enough, we asked an open ended question, and we've never done this before in our surveys. So, this year we asked the open ended question of, how has the end of ACP impacted, your life? We had 33,000 responses. So it took us a little while to get through all of them.
Yeah,
And I'll just share with you a few antidotes, if I could, on
sure.
what people
Please.
said.
Yeah.
So yeah, so we have one was being homeless is hard enough without the challenges of not being able to communicate with the rest of the world. The discontinuation of ACP has nearly devastated me. Just the simple task of communicating with government entities, potential employers, and family has taken up so much time now because of not having internet access. I'm barely able to maintain my life as is, let alone get ahead. Another one said, I'm struggling to pay for internet every month. I have to choose between my internet and my medicine, and I have an 11-year-old who needs the internet to complete homework. I desperately need the ACP program. Here's one that said the Lifeline program is exactly what it says it is, a lifeline for my family and me. It gives me great peace of mind knowing that I can stay in communication with our doctors and appointments, and we can stay in contact with our other family members. And then the last one that I want to share says that without ACP, going to college has been all but impossible. It's crippled my studies by at least 95%.
Horrible. I mean, just absolutely devastating. And like you said, you got thousands of responses. I'm sure many more along those lines. I'm looking at a couple right now. I'm currently fighting cancer, this person says. And now, since the ACP ended, I can't afford Wi Fi. So it's close to impossible to keep up with my medical needs. That's insane. Another person, I think, references something that is maybe not something we were thinking or everyday people were thinking too much about. But this person says, at first, I didn't think much about losing ACP, but now I'm constantly running out of data. So that was something you guys looked at too, right? The amount of data that people need. Certainly, being forced off of an ACP program might mean that they need to subscribe to lower data plans and such, right? That's, you guys saw that that's affecting people too, right?
We did, absolutely. And one of the things that we've talked about now for a while, especially on the Hill when we're meeting to talk about how important the funding is for ACP, is that data sustainability is important. So without ACP, there are people who will be able to go out and maybe spend $20 this month to get a prepaid plan and buy, how many ever gigs of data they can, and they use it this month and maybe next month, and then something happens, a kid gets sick or the car breaks down or whatever. I mean, life happens, and they don't have that $20 to go buy that plan again, so now they have no data access. If it's somebody who maybe is unemployed, the job applications that they had applied for, the employer can't reach them back. Children can't do homework. Parents aren't able to be in touch with the schools, without going in person, which we know transportation is an issue for our population. So, data insecurity is a big deal.
Indeed. Okay. So, Without the Affordable Connectivity Program, did your survey look at how respondents are accessing the internet and how that access has changed? Obviously, the data is a big part of it, but I noticed, there was a question about there were some responses about using friend and family members' internet instead, or going to the library. Talk a little bit about what we learned about how people are changing their internet habits based on ACP going away.
Sure. So we learned that without ACP, many of the respondents have reported to having to change their plans to a lower amount of data each month or a more affordable speed. So slower speeds, lower data amounts. And then nearly 95% of the Lifeline and ACP subscribers say that they can't afford any additional payments towards their monthly service, which does affect how they can access the digital world. So they go to the libraries, they, go to the neighbor's house. They are, like we saw during COVID, they're going to McDonald's and sitting in the parking lot to get Wi-Fi, things like that, which is not what we want for
No,
our.
I mean, here we are again. It's so unnecessary. And it's just also to think about how taxing that is for people who are already dealing with so much in terms of low income status and, everything that comes along with that, to not be able to know where your internet access is coming from moment by moment, or if it's going to be reliably there for you to connect with family and friends, go to the doctor online, et cetera, things that people like me take for granted every day. It's in itself extremely taxing for people.
In a lot of our advocacy work, we've heard from different offices that we meet with where they say, we didn't see the outcry from the consumers that we thought we would, and I try to remind them that, well, one, you disconnected their service, so they don't really have a way to reach out to you, so that's
Hmm.
that's one issue, and
Hmm.
then the second issue is that, especially for the members of the National Lifeline Association, the segment of the population that we serve are the most vulnerable people that are out there. We're serving homeless people, people that are underhoused. Maybe they're living on the street for a few days. They scrape up enough money to get into a motel room for a little while, or maybe they have a car and they live in the car. So these are people who, if they had the ability to advocate for themselves in a way that would allow them to reach out to their congressional representative, they most likely wouldn't be in the position they're in and wouldn't need this program. So important for people to just kind of understand the consumer that we're talking about here. And I don't think everybody gets the fine point there.
Yeah, no, that is a very cynical position for lawmakers to take.
Right.
Okay, I won't go too much farther on that, or I'm going to get really annoyed. Okay, so
Sorry.
all right, so we are speaking a couple of days after the White House OMB issued a memo that was pausing federal grants and loans. At the moment, nobody really knows what's going on because there's a lot of mixed messaging. Maybe by the time this podcast runs, people will have an idea of what's happening. But there was speculation when that memo first came out that it could impact Universal Service Fund programs like the Lifeline program. Simultaneously, the USF, which funds Lifeline, is awaiting its fate with the Supreme Court. So a lot of question marks around the future of Lifeline, in addition to the ending of the ACP. Not asking you to predict this future right now. That would be really hard for me to ask of even the most esteemed psychic medium, I think. However, what does this general uncertainty around critical programs like this mean for people on Lifeline and the people in who are in your constituency at NALA? And
So it's been hard. I think Tuesday was the most taxing day I've had in quite a while. It was, whiplash because
yeah.
nobody seems to know what's going on, right? The order came out, and the beginning of the day it was, it's just going to be grants, and then that turned into, oh no, it's everything, and then that morphed into, well, individuals won't be impacted, and so as I sit here today, 2 days later, I wish I could tell you that I believe Lifeline's completely safe. I don't know. I mean, based on the information I have, I think that we're going to be okay, but there's just not been a lot of communication, and what's out there has not been super clear as it relates to this order. So, hoping that next week we're going to learn more. It sounds like there's some litigation going on, and maybe there will be some clarity that comes out of that. I can't imagine that Lifeline's going to go away. I think that we've needed reform in Lifeline for a long time because, as you mentioned in the beginning, it's a $9.25 a month subsidy for a provider. It's really hard to give a consumer the amount of data they need for $9.25 a month.
Yeah.
And then, what we've seen after ACP going away is that consumers got used to that amount of data. So in the past, where they may not have used the full amount of data that we give them, which is 4.5 gigs of data, which is not a lot, they would use it for emergencies and kind of ration it. But after ACP, they kind of got used to using data. So now we're seeing them use that 4.5 gigs quicker in the month and then being without data. So there definitely needs to be reform to Lifeline, which is something we've been working on with USF reform. I think that there were some good ideas that came out of the USF working group that would make a program that would be sustainable, going forward without having to go to appropriations. There are some people who think it should be an appropriated program, but
Which is how the ACP died.
right,
So, right.
exactly.
So
And yeah,
I don't know
so
about that.
yeah, for my quality of life, I hope it's not appropriated because that means a lot of time in DC. But
Right.
so
Right.
yeah, so I mean, we're just waiting now. I think kind of all efforts are on pause, waiting for the Supreme Court to take up this case that the Fifth Circuit ruled on that says USF is not constitutional. So we're all kind of just waiting for that, I think.
Yeah, I was going to ask you, how you all are advocating for USF's preservation and a future ACP, but like you said, a lot of it rests on what the Supreme Court is going to say, and we're expecting that decision in June, right?
Correct, and we NALA submitted a amicus brief
Hmm.
for the petition to kind of explain a little bit more about Lifeline and why it's important and who it serves. So I'm hoping that that will be helpful to
Yeah.
to the judges making the decision.
Let's hope. And in terms of, a revival of the Affordable Connectivity Program, there were some efforts last year to bring it back with various bills. I've written probably 1,000 stories on each one that came up and died, and each way that they were going to bring it back to life. A person named J.D. Vance, who's currently vice president, when he was senator, he was advocating for one of those bills. We have not heard much from him on this program since he was named running mate to Donald Trump. But I guess we could start asking him that question again if anyone can get in touch with him if he thinks the ACP should come back. But in terms of what you guys think, do you see an ACP reemerging? If the USF gets saved by the Supreme Court, do you envision trying to expand Lifeline into a program that encompasses ACP, or do you, in the meantime, want to go back to the drawing board and see if Congress will fund an ACP before we even wait for the Supreme Court's decision on USF?
Right. So, well, we're doing a couple of things, and we are hopeful that Vice President Vance will continue to hold the position that he had as the senator, and we're looking forward to working with him and his team. I think the last time I was with you, I don't remember which effort was really close. And I remember closing by saying, Christy Brown and I said, we're fighters, we're not giving up. And I still hold that. I mean, it was a little discouraging that we got to the end of the year and weren't able to get anything done. But I'm hopeful with, the new Congress and the new administration that we'll be able to move something forward. I think the most likely outcome is that it's going to be, the programs will be merged together in whatever the USF reform is. The challenge with that is trying to do something in the interim to help all of the people that we just talked about. So we haven't given up our effort to find interim funding for this program to help those consumers. So hopefully we'll be able to make some progress with Vice President Vance and others that have advocated for this program in the past while we wait for the Supreme Court to make a decision.
Okay, well, so much to keep up with and look forward to. Thank you so much for taking some time to chat with me about this. And I hope that you'll come back as all of this continues to progress, and keep that optimism alive.
As is my pleasure. Thank you for having me. Always happy to answer any questions.
Thank you again, Danielle, for joining me. Thank you as well to Pierre Landriau for editing this episode. Be sure to subscribe to the Light Reading Podcast for more episodes of The Divide, as well as interviews and insights from the Light Reading team. Thank you for listening. We'll see you next time.